Hi friends, today there is a very important message for you. I think you have heard many bright luminaries among ourselves, many doctors, many politicians, film stars, friends, colleagues and students die suddenly because of cardiac arrest. They might be doing some exercise in the gym or walking or preaching or speaking in the public. During that time they suddenly collapse to the ground and they die within a matter of minutes. So people would be totally surprised, they are taken aback and they don't know what to do next. Immediately they tend to take him to the hospital without doing any first aid measures. This first aid is called cardiopulmonary resuscitation or cardiac massage. This is important that this should be done within 7 minutes. 7 minutes. It shouldn't be delayed beyond that. If you delay, this would result in the brain damage, and even if you do something really for the patient, he would be left with a total brain damage and he would be just like a vegetable or in a persistent vegetative state. Okay. So the important message is that the moment you find someone suddenly collapsing, just shake him vigorously. This is first, shake him, call the person by name, by shaking. If there is no response, just as this is breathing by keeping your finger somewhere. Normally you expect some breathe in and out, or you can sit near him and see the movement of the abdomen up and down to look whether he is breathing, and if possible check the carotid pulse here. But if you can't, don't do this. Not a must. But if you can do that, it's well and good. Then you immediately tell your friends or colleagues to call the ambulance, call the doctor or the whoever is responsible, and immediately you start the cardiac massaging. How to do the cardiac massage? I'll put a video after my talk. So you apply you lock your fingers. The wrist should be straightened, the elbow should be straightened, and the whole weight should come the shoulder. Your body weight should come down like this. Okay, and this should be at a rate of 100 to 120 per minute, and there should be it should move the chest cage at least 5 to 6 centimeters down. Okay, and this should be at a 100 to 120 minutes per 20 per minute, and after every 30 massage is better that you do a mouth to mouth breathing or artificial ventilation. But if you can't do, it's not a must in adults, but in kids after every 15 minutes massage, you stop and do 2 breathing into the mouth. You can just exhale. You can exhale into the mouth directly or with a kerchief and all. That's a must, unlike in adults where you need to do only the cardiac massage. Okay, and this should be continued. Most of the time, in kids you need to apply only 2 fingers down, up and down like this, but in adults it should be with the full weight of the body should be there, and there should be 1 or 2 people who should help you during the cardiopulmonary resuscitation or the cardiac massage. That is you try to do for 1 or 2 minutes, because it's a tiring job, because after 1-2 minutes you will be tired. Immediately the next person should take over. He should continue for 2 or 3 minutes, then you take over. Until then this cycle has to be repeated for 10 minutes, 30 minutes, 60 minutes, like that, until the support or the medical facility comes. It is reported that 26% of those CPR, the cardiac arrest service can be normalized. It can be normal within a month. It means that if you could start the CPR within 7 minutes, or at the earliest could save many lives. It's so disheartening to find that many people, suppose somebody gets a heart attack and falls down. People would just immediately take them to the take them to the hospital immediately without doing the CPR, and finally what happens is that the person reached the hospital, he would be almost brain dead, and he would be there in the ventilator for 1 or 2 days or a week, and finally he will be left alone. He will die within a matter of few weeks or months. The immediate message is that don't let this happen to you, to your family, to your relatives or to your colleagues. Immediately do the cardiopulmonary resuscitation. The cardiac massage should be done immediately. Don't waste. Okay, Right. So I'll put a video after this where how you should proceed with a cardiac massage. This has to be circulated and to the public, to your friends, colleagues, and many new new organizations should come forward and learn this technique. They should be trained. We will train them. If they are interested, you can contact me or my organization. We will train you, and we can dissipate the knowledge around you and across the state and maybe across the world. Okay. So my contention is that try to master this technique. Every individual should know this, especially all the students in the school and the colleges and all. Everyone should be taught the technique of effective and fruitful cardiopulmonary resuscitation, and they should be trained. The various mannequins are available, and we can provide them the techniques of how to do that. We have videos there. They can come to us. They can we can train them. We can train them in groups so that they can train their colleagues and all at their local areas. So I think this should be a chain, and this should have a momentum on its own. So it's not for me, you, or someone. It is for us, because we see a lot of our friends and relatives, doctors, engineers, politicians, our leaders, or various actors and all dying without no cause. They may have some problem. Maybe last couple of weeks we lost around 3 doctors, young, very athletic doctors and all. They suddenly died. Maybe some cardiac arrest and all. We could have saved them by effective cardiopulmonary resuscitation if there were any people who are trained in CPR or cardiac massage. I think it is not a very rocket science and all. You can just take cakewalk. You just need to train the basic. That's it. 1, 2, 3, 4. That's it. That is you see whether his heart is working, whether he is breathing. You inform your colleague to call the ambulance. Shake him initially. Then look at the pulse if possible. But if you can't feel the pulse, don't do that. Look at the respiration and immediately start cardiac massaging, and if possible give the breathing, but it's not an absolute necessity in adults. And continue this cardiopulmonary resuscitation for maybe 60 minutes or longer until the medical facility arrives. Then you can hand over to them. They will do other defibrillation depending on the cardiac status and the rhythm, maybe artificial ventilation, ambu bag and other things. I think we have to train all our friends, colleagues, students, and everyone in the country, so much so that we can save many lives, in the coming days and years. So if you have any query or question, you can contact, and we will train you. We will train you how to do the cardiopulmonary resuscitation, so that you can dissipate the knowledge and you can be the trainer of TOT or trainer of trainers. Okay, we lose lots of lives without any definite knowledge how to do a cardiopulmonary resuscitation or cardiac massage. This video is intended to tell you, to train you, or to make you understand how to do a CPR or a cardiac massage in any circumstance, so that you can save many lives. You can train your friends, you can train colleagues, and if you really want to learn, then you can come to us. We will train you how to train your friends and colleagues in the cardiopulmonary resuscitation. I think this should be a continuous cycles without any breakage. You get trained, you train your friends. Maybe if you have got any doubt, you can come to us always. We'll train you to become a trainer of trainees. Okay.